Well, as it gets warmer, we're going to want to show off our legs a little bit more. But what if you have a serious condition known as varicose veins? Well, Dr. Jennifer Heller is the director of the Vein Center at GBMC, and she is here to help. How are you?
Hi, good morning, Elsa. Nice to see you.
Good. I'm glad to have you here. So let's just start out with the basics. Lots of people are very sensitive about their legs, but varicose veins are it's very serious business. Can you just explain what they are to begin with?
Sure. There are two kinds of tubes that carry blood in the body, the arteries and the veins. The arteries bring blood from your heart down to your legs, and the veins have the more difficult job of bringing blood back up to your heart and lungs against gravity. And the way that that occurs are with little structures inside the veins called valves. The valves work to push the blood back up and then also to act as a trap door so the blood doesn't fall back down into your legs. And when those valves don't work properly, varicose veins can occur.
Got it. So what are the risk factors of that?
There are many risk factors for development of varicose veins or venous insufficiency. And that term sounds very complex, but again, venous insufficiency just has to do with the vein valves, like we just talked about, not working properly.
Got it.
There is a genetic component to developing varicose veins. So if you know your mother or your grandfather who have had them, you likely are at greater risk. As we age, we are more prone to develop varicose veins. Females are more likely to be afflicted with varicose veins, and that has to do with hormonal changes, and also women who have had multiple pregnancies are at a higher risk for developing varicose veins in the future.
Got it. Okay, so what can cause the blood clot?
When the vein blood stays within that area, that bulging varicosity or that larger area that sometimes we can see on our legs or feel, the more blood stays in one place, it can cause the blood to congeal or to clot, and that can cause a superficial, what we call thrombophlebitis. But certainly over time, if that stays without being addressed, that superficial blood clot can eventually, almost like a domino effect, travel into the deep veins and cause a DVT.
So of course we want to treat that. What are some of the treatment options that are available to patients?
There are a wonderful array of minimally invasive techniques that we do here at the Vein Center at GBMC to fix the circulation, to remove these areas of varicosities that will not only fix the circulation, but also have your legs looking fantastic.
So what are the considerations for summer? I think that's the part a lot of our viewers are waiting to hear about. What should we consider?
Absolutely. Well, I'm hoping that we'll all be able to start traveling safely again. And so with travel comes a lot of sitting in one place for a long period of time. And so it's really helpful that if you're in a car or if we're all finally in planes again, that we think about hydrating with water and aisle seat if you're prone or if you do have varicose veins. And also walking about the cabin or coming out of your car and walking around the rest stop every few hours. And that will prevent that blood from sitting and pooling and being too stagnant in your legs.
I think that's a good reminder just for us, even if we're not traveling, just being in the house so much with this quarantine. So that makes a lot of sense. If we have questions for you, I've been told that you have an upcoming event that we can bring all those questions.
We do. We have a very pandemic-friendly event. We did one this past October. It was a drive-through screening outdoors, so everyone can stay in their car, swing their legs out of their car door, and I answer any questions that you have, examine your legs, and hopefully allay anyone's concerns. And so we're doing it in the spring. It's super fun. Yeah. We have little prizes and gifts and questions, and no appointment is necessary. You can just come drive by.
It really is amazing just how creative we've gotten with making sure that people are taking care of their health. Even if it means that you're going outside, meeting people in the car, it really shows how much GBMC is dedicated to helping their patients. So this is happening Friday, April 9th from 9 a.m. to noon. No appointment is necessary. You just want to call 443-849-6123 if you want to get some more information. But again, no appointment is necessary. Dr. Jennifer Heller, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.